Welcome. It's another day, another time, another period to talk about knowledge acquisition on health matters. Knowledge is power, health is wealth. Today, I shall be going into finding out or investigating urine frequency. I titled it Frequent Urination Investigated. You may be a younger person than I am, but no sooner we all age, especially female, you come to experience frequent urination. It's hard when one is young and is not experiencing any urinary tract infection. But as we grow old, it becomes a common problem. The reasons are not far-fetched. Ordinarily, one could just ascribe frequent urination to bladder problems, because if you take too much water, you will have to excrete more. The body excretes up to 1.5 liter to 2 liters a day. We are expected to take up to 2 liters of water in a day. It is just a problem of urinating the excess you have taken, especially those who drink very late in the night. There are situations where you are probably taking these diuretic drinks, alcohol, caffeine, and all the stuffs that will prompt frequent urination. But the bladder in itself could be infected. It's called cystitis. And all I'm trying to do right now is for us to go through the journey of investigating the cause or causes of frequent urination and how we can help prevent it. Right on. The objective: 1, to know when urinating is normal or abnormal. What are the causes of frequent urination? 3, how do we investigate to know if it is abnormal? And the 4th one is, can it be treated? Yes. Urination is normal. From the definition, urination is expulsion of urine from the body. If you do not excrete it, you will drown. The body, there will be edema everywhere. Urine is a waste product of vertebrate, gotten from metabolic reaction. For example, we have heard of respiration. We oxidatively break down carbon dioxide to produce energy we need. Intermediate metabolite, carbon dioxide, and water. These are end products. Water is expelled mainly through the kidney and stored in the bladder until it's full. When it's full, the bladder will excrete it out because they to contract and excrete it out. Water could also be excreted from many other parts of the body as a diluent of substance by vomiters and what have you. All the other normal things we'll do is the quantity of urine expected we expel is about 1.5 to 2 liters per day. So if you take up to that quantity, you would equally excrete that quantity. Apart from the respiratory process, when you drink water, you excrete more. Urine is concentrated when you don't drink water at all, and the urea gives us a color. One is expected to urinate about 7 to 8 times daily. That is normally, but nocturnal patients urinate often for about 2 to 3 times. They wake up from bed and they're probably due to medication or when they drank too much water. Causes of incontinence. It is very common in women immediately after puberty or when they are sexually active because of introduction of infectious agents, especially during sex. It is also common in elderly menopausal women because of low estrogen level that makes the urethra thinner, so the urine passes with pain and more prone to UTI, urinary tract infection. Bladder stones forms, especially during dehydration and protein breakdown. That is serious protein breakdown. If the person eats too much proteinous food, can naturally pass through the urethra, and there is that problem too. Diabetes insipidus. That is a situation of where you are always producing too much urine. That is polyuria and polydyspia. You are also tested as you are producing this voluminous number. The 3 most common causes of cranial diabetes insipidus are the brain tumor that damage the hypothalamus, the pituitary gland, a severe injury that damages the hypothalamus or pituitary gland, or complication that occurs during brain or pituitary surgery, and that causes that low antidiuretic hormone, which will make more urine to be produced. Bladder cancer and radiation. If a tumor is present in the bladder, it takes up space that could otherwise be filled with urine, thereby reducing the size of the bladder. The bladder is about a pint. It contains about a pint, but when it's reduced, it continues to urinate quickly. Excess consumption of total fluid, alcohol or caffeine. These are diuretic in themselves. When you take these things, you are prone to continue to wee-wee, because they act on the kidney itself and makes the bladder full quickly, and you continue to urinate. Interstitial cystitis, this is the inflammation of the bladder itself. All the other problems we could be talking about are outside the bladder. It could be from up, that is the kidney or the urethra, but this one is affecting the bladder. You can see from this picture, the bladder is thickening, the wall is thickening, and then there is inflammation of the inside. So the bladder is easily irritated, and it continues to pee. The kidney infection too. You can see the two kidney. The one on the left is the normal kidney. You can see the appearance of the cortex, that is the coffery. You can see pus deposition. It is a urinary tract infection of one or both kidneys. The patient usually has fever, pain in the back and trunk, and the flanks, and painful urination. That is very common with pyelonephritis. Pregnancy. This is because the babies they are carrying cause the uterus to expand and put extra pressure on the bladder. This baby usually even kick the bladder, and that's why the bladder is irritated and there is urine. Diabetes type 1 and 2. The symptoms occur because an excess of sugar causes additional fluid to move through the kidney, and when the body cannot regulate it, it brings out more water to clear the sugar. Vaginitis is an inflammation of the vagina. That is another one of the reasons for excess urination in women. Type of vaginitis are yeast infection, trichomoniasis, and bacterial vaginosis. Even that one produces a fishy odor. So the irritation of the bladder is there too. Sexually transmitted disease is also a painful experience, especially in men. Women produce too much frequent urination, and men too, because they cannot empty their bladder easily. The anterior vaginal prolapse. Tissue between the vaginal wall and the bladder stretching and weakening, causing the bladder to extend into the vagina. So you can understand the kind of problem. It's a prolapse anyway. The prostatitis is infection common in men, and when there is the bladder rests more or less on the prostate. So you can imagine the picture you see here. The normal bladder, that is the urethra. The urine can easily flow, but look at the one that has enlarged prostate gland. It has constricted, narrowed the passage of the urethra, and so the urine has to be coming out little by little and frequently, painful as well. So that really tells us. So let's look at how we can investigation of these various urine that are being produced. In the laboratory, you can do the microscopy to look for the kind of things that are inside, the appearance, the color, and what have you. The next is to do the urinalysis. This is the bottle called heuristics, and that stick is what you dip inside the urine and compare, so that when you compare, you will be able to tick one by one the color, the clarity, the pH. The thing will be reading it, the glucose, there's blood inside, ketone, urobilinogen, bilirubin, and all that is listed would has meaning so that one can receive correct treatment. The microscopy means you have to use the microscope. The light microscope is used to examine a deposit of the urine after centrifugation using the centrifuge, and the centrifuge is pictured here. So all the things that you see under the microscope are the red blood cells, white blood cells, if they are. So that's the centrifuge, and this is a stain slide showing the neutrophil apart from the white blood cells, monocyte. Culture and sensitivity. These are culture plates. The Maconche is not included, but the colonies are there. And then the sensitivity is what you see. That area is showing that the antibiotic is sensitive, the clear zones. But when there is no clear zone, it means it is resistant. Routine blood tests could also be done. Blood tests, that is what we shall talk about. Routine blood tests can check for kidney functions too, like glomerular filtration test. They want to know the filtration rate, the electrolytes imbalance, and blood sugar, oral glucose tolerance tests. All these are samples that you can collect. The sample for the glomerular filtration rate, you also need the urine as well. This is also showing us the cystometry way, a test that measures the pressure inside of the bladder to see how well the bladder is working. Cystometry, that's the meter, is done to determine if a muscle or nerve problem may be causing problem with how well the bladder holds or releases. The screening test for prostate, called prostate-specific antigen, it is tested especially where there is a suspicion of cancer, the prostate cancer, and the normal value should not be higher than 4. So anything higher than 4 gives you concern. Then the doctor can use cystoscopy, and you can also use bladder scanning using ultrasound. The treatment, you don't need to give any medication, but just exercises. If they are very elderly and wee-wee, it is a very common problem with the elderly to have problem with urination. So the Kegel exercise by a therapist helps to train them on how to strengthen their muscle, the bladder muscle, and the floor muscles. These are all training, and how to avoid urine by prompting, so that they control all these things. Then if there is a growth of E. coli or what have you, the sensitivity antibiotic is done. Cancer therapy is also done. Acupuncture could also be used. This is just to show us the Kegel exercise, and it's a common phenomenon. I mean, it's a thing that even the pregnant people do to strengthen their pelvic region.